Hi, I'm Dr. Tan Cheng. I'm the obstetrician and gynecologist in Dongxing Hospital.
Assisted vaginal birth means the usage of either vacuum or forceps to assist during the vaginal delivery. 10 to 15% of all women give birth by assisted vaginal birth. If this is your first baby, you will have 1 in 3 chances of requiring assisted vaginal birth. Vacuum-assisted delivery requires the use of vacuum cup. Vacuum cup can be metal or silicone-based. This is an example of metal cup. This is an example of a forceps. Why does a mother need a forceps or vacuum for the delivery? Things may not be going as planned during vaginal delivery. The ideal situation is of course for a mother to deliver a healthy baby by her own effort. However, there may be certain situations that requires assistance to deliver the baby. Assisted vaginal birth is indicated when the baby's well-being is compromised. This can be detected via the baby's heartbeat patterns during monitoring. Other indication is when it takes longer than usual for the baby to be delivered after the cervix is fully dilated. This is also known as prolonged second stage. Other medical indications, such as the presence of heart disease, may require assisted vaginal delivery to shorten the duration of delivery. Usage of epidural analgesia may increase the risk of assisted vaginal birth. Episiotomy, which is the cut over the perineum, may be required. Every procedure is associated with its own potential complications. However, serious complication is uncommon or rare. 10 to 40% of the assisted vaginal delivery may have the risk of increased bleeding comparing to normal vaginal delivery. Vaginal tear is very common. 10% of vacuum-assisted delivery may have extensive vaginal or vulval tear. 1 to 4% of these cases may have injury to the anal sphincter or rectum. Swelling over the baby's scalp is very common following vacuum-assisted delivery. 1 to 12% of the cases may have some amount of bleeding in the scalp. Only 0.3 to 0.6% of the cases will have extensive and serious bleeding. Bleeding that extends into the brain is uncommon. It is around 5 to 15 cases in every 10,000 cases. You may notice some lacerations or skin breaks over the scalp after vacuum-assisted delivery. This can occur in about 10% of the cases. After assisted vaginal delivery, 5 to 15% of the babies may develop jaundice. Retinal hemorrhage, which is bleeding at the back of the eye, may occur among 17 to 38% of the cases. Your doctor will provide you with adequate painkiller during and after the procedure. Some mothers may face difficulty in passing urine after the procedure. This normally will resolve later. Prior assisted vaginal delivery, careful assessment will be carried out by a doctor to ensure the maximum safety for both the mother and the baby.